Los Angeles County's coronavirus numbers continue to fall, with officials reporting 423 new cases of COVID-19 and 20 additional fatalities on Sunday, March 21. The number of county residents hospitalized with the virus continued to decline, dropping from 792 Saturday to 750, with the number of those patients in intensive care declining from 216 to 191, according to state figures. Sunday's numbers brought the county's totals to 214, 178 cases and 797 deaths since the pandemic began. The lower number of deaths reported Sunday may reflect reporting delays over the weekend, according to health officials. Hospitalizations fell to 750 countywide, the lowest level since October 17, with 190 people in intensive care, the first time that number's been fewer than 200 since October 6. On Saturday, when 521 new cases of COVID-19 were reported, the Los Angeles County Department of Public Health said more than 70% of those cases were from people under the age of 50 years old, while 93% of Saturday's 56 reported deaths were over the age of 50. Many younger people are out socializing with non-household members, raising concerns that asymptomatic young people are unknowingly helping to spread the virus to more vulnerable people, Public Health Directors Barbara Ferrer said. Though we are making good progress in our vaccination efforts, we are entering a potentially perilous time if people let their guard down. It is important that we remain disciplined in our adherence to use of face masks, physical distancing, avoiding large gatherings, and delaying any non-essential travel. This is particularly important with the recent movement of the county to the red tier and as restrictions get lifted. On the vaccination front, officials said doses at county-run sites would be limited to second doses this week due to supply shortages. The county crossed the milestone of administering 3 million doses last week, and its science officer said planning is underway for an anticipated dramatic increase in vaccine supply in hopes of eventually doling out 1 million doses per week. The county currently has the capability of administering about 630,000 doses per week, but due to limited supply, only about 300,000 to 350,000 doses are actually being administered per week. Next week, the county will only be receiving about 280,000 doses, although that number will be augmented by supplies sent directly to some providers, such as the federally operated site at Cal State Los Angeles. Dr. Paul Simon, Chief Science Officer for the County Health Department, said Friday that given the progress already being made in vaccinations, if supplies dramatically increase by late April or early May, as predicted by President Joe Biden, the county could move rather quickly through the rest of the population.